morning, Dr. Erum. How are you? It's been a long
Yes, I'm good. Good morning.
weeks.
Just
Yeah.
listening to this song, I was just saying that Atif Aslam he's coming to Dallas.
Oh,
So
yeah.
we are planning to,
He was
yes,
here.
yeah, in October.
In October. I think he was here in New York a while back or recently, or New
Hmm.
Jersey. All the places he was here. Yeah.
Yeah,
He's a
maybe that
very
they do all the tour. Huh?
Yeah. No, they do, and they do all around this time and sometime in the summer. They do.
Yes, yeah.
And, it's good to see them because I enjoy the programs live. तो देखने में मजा आता है.
Hmm.
I want to welcome you to. It's been a couple of weeks. I think the summer, middle of the summer or something like that. I was going on vacation, and we all were really, really. That's why I think we haven't.
Yes, I think just before the school started. So it's been
I think
it's
in
been few weeks.
Texas the school starts early, right? Than New York, I think.
Ah, right, right. I think we here they started August 8th or something like that. Yeah.
Oh, almost a month
Mm.
before, 3 weeks before, at least 3
Mm.
weeks. A month. So anyway, Dr. Adams coming with a very important subject today, and then I think we had requested that last time when when we had the last session, and it was requested by everybody that we want to talk about thyroid. So good morning, Asha ji, good morning, Kamlesh ji, and to both of you, thank you for joining. And remember last time we had discussed that we want to talk about. I think Asha ji has suggested about the thyroid, and as you all know, there are two different types of thyroid. Plus, a lot of things are associated with each one. They're different, and in some ways they're alike. I mean, doctor knows much better than I do, but I know that one with you put on more weight, and one you lose the weight. Hyper and hypo. So
Correct, yeah.
yeah. So I'm one of those which has the hypo. So I know I've been taking the synthroid for the last at least 15 years now.
Mm.
Yeah, 15 years. So
Mm.
it does have some side effects, but I guess I'm used to it now. आप इसमें आप ही हमको समझाएंगे क्या होता है with each one. And welcome to this platform today. Thank you so much for joining and taking your
Yeah, I mean, of course, this is always because I just, with this opportunity, I just, just learn more because I'm just doing some more research and seeing things and things like that, because sometimes you have read about these for years and now there are many things. Plus, as I have done with the lifestyle medicine and also I'm just trying to see that what could be the other things besides medicine, which can help with these chronic issues and problems. So, I mean, of course, as you know, that thyroid gland is a gland which is in front of your neck. And this hormone, it produces a hormone which is needed for every cell in the body. So it just works for the metabolism of the whole body. So every cell in the body needs thyroid. So that's why it's so important. And again, there is a very complex, function of it and how it works. There are different hormones which are secreted from your brain, which then affect in turn on the thyroid gland, and it produces then the thyroid hormone, which is the inactive form, and it comes to your periphery or skin and different parts of the body where it is converted from inactive to active form. So it is a very complex, like a network where you see the actual active form of it after going through different stages. So again, I mean, of course, there are different types of problems which you can have with the thyroid issues. One is hypothyroidism, which is very common and most of us, they have it. The other one is hyper, which is the increased production. Then, of course, there are different cancers of the thyroid gland also. Veena, I just wanted to check that how did you find out that you have low thyroid
I don't
15
know.
years ago?
I think it was a routine blood check, blood work.
Uh-huh.
So they must have Like when you go for the yearly checkup, they usually do everything, all the whole blood. They do all the blood check. I mean, all the different diabetes and
Mhm.
cholesterol, and I think they might have had a doubt. They probably felt there's some.
Mhm. Mhm. And
Oh,
sometimes you have symptoms also
yeah.
for the hypothyroidism, but again, these are very like vague symptoms in a sense, unless it is very severe that you have other issues. But most common symptoms or signs, sometimes, usually we all have it, especially women. And it can happen with the other issues too, which is very common, other issues too, like where you are tired, lack of energy. Mostly you see that you have hair loss, then thinning of your eyebrows, and some skin changes and all, which can happen in some of the other problems too, like when you're anemic, and sometimes you just are fatigued and things like that. But yes, you're right that usually the doctors, they check with the blood work, which is very common, especially when women, when they are pregnant, they usually check that too. So mostly they can find out any kind of thyroid issues during pregnancy also. But of course, this is totally a different issue with the thyroid during pregnancy. But of course, with the other non-pregnant women or other men too, that is taken as differently. And as you know, that women usually are more prone to have this low thyroid problems, and with the advancing age, when there is decrease female hormones, estrogen, so you can have low thyroid levels. So again, of course, you know that sometimes some of the most common signs and symptoms is, as I just mentioned, you may have some skin changes, hair loss, just fatigue, and you just think that the thyroid hormone, it is needed as an energy for all the cells, and when you do not have that, the heart has to function very hard, and sometimes the heart can have issues. Sometimes if it is so bad, it just doesn't function as it should, and then there is a lot of swelling in your legs and things like that. So those are like more common signs and symptoms. So again, when we go to the doctor, when there is a problem, usually we check the thyroid function test, which is the TSH. So when TSH is high, that means that your thyroid function is low, which is the T4 is low. So you have to check your T4 levels. When TSH is checked and it is low, then you have to do another testing, which is T4 and T3 level. So T4 is the inactive form of the thyroid, which is converted into T3. So when you go have these symptoms, so first the blood work, which they do is TSH, and depending on if it is high or low, then we do more testing, which is the T4 and T3. So a most common cause of thyroid hypothyroidism is basically, it's called Hashimoto's thyroiditis, meaning that the body just forms autoantibodies, like it is like an autoimmune problem. So meaning that it just makes autoantibodies against the thyroid cells and decreases its function. So that is very common. But there are other causes. Sometimes people who are on some different medications, for example, amiodarone, this is one of the medicine which is for atrial fibrillation and some heart arrhythmia, that can cause different hypo or hyper kind of thyroid problems. Then there are several other medications which can cause it. Well, one of them is lithium for, sometimes they use it for some mental health disorders. So those are the things. And usually when sometimes radiation of the head and neck can cause issues with the thyroid. When you go to a dentist, when they do your dental, the x-rays, they usually ask you to wear a kind of a gown where you protect the thyroid through the neck, which, the radiation or that would affect. So those are the things which are can be the causes of thyroid dysfunction. So those are the things, but anything else you have to add, or any questions so far? Or after taking your medications, have you seen any changes like before and after kind of thing, Veena?
Yeah, mine, I was taking 0.25, but that's how I started.
Mm-hmm.
I think micrograms is it called, or whatever.
Yes, yeah. Mm-hmm.
And they increased it to 50, and now I'm up to 75. So I don't know. I do sometimes
Mm-hmm.
get more tired, and but I thought maybe that's because I did a lot of work, but it could be
Mm-hmm.
because of this thing. But like I said, when the blood work came in, when the doctor did mine, and then they said you better start taking the low dose. So I think for me, I didn't really feel any. I mean, when you take the medication, you don't really feel anything. And the first thing I do in the morning, the first thing you're supposed to do in the morning when you get up, is take the Synthroid.
Correct, yeah, because you have to take it with in empty stomach, so you cannot have any food or anything for at least 2 to 3 hours. So that's why first thing in the morning, yeah.
Right. Okay, yeah, that's it. So that's why I guess first thing in the morning, that's what my routine is, to take this before I take anything else. The first thing is to take mine. I'm taking the generic, which is called the levothyroxine.
Mm.
That's not the original one, but they said it's the same thing.
Yeah.
So that's what I'm doing right now. And um, but the thing is that in the long term, if you keep, I mean, since I'm taking this medication for long term, does it have any effect, or does it clash with some other medications that I'm taking, or is it harmful to just keep on taking it? Does it work, or does it have any?
Yeah, so I mean that's the thing. That's what when we do the lifestyle medicine, meaning that when you have to change your whole lifestyle, and of course these again these are the routine thing, and as I said, that is very common, and probably so many people are on Synthroid. So of course it's always to consult your doctor before taking, or I mean, of course, whenever they do the testing and you have to start taking medicines and all. But that's what I wanted to talk about before starting the medicine, or how to prevent these things with the food and your lifestyle, so you do not have to take medicine. So basically that's what lifestyle medicine is, that where you have to take medicine. Of course, there is nothing that you can avoid that, but we want to see that what are the things, food and lifestyle changes, which we can do to avoid taking the medicines, or at least delay, or until it becomes so severe that you have to, and you cannot control it with the food and the things.
And the things to avoid, I mean, the food to avoid is all the green vegetables like spinach, cabbage, kale, um, anything like.
No, not to avoid. I mean, of course, sometimes, again, because we always talk about this, that most of the things like plant-based diet, the clean diet, with not processed diet. So basically, this is the basic food type which has the most effect on your body, meaning that it can just control many diseases. That's why we always talk that for every medications in your routine medical problems, you have to take each one medicine for every other issues.
Right.
But when you have this clean diet and plant-based diet, so it works for everything basically. So same with the thyroid also, meaning that if you are on plant-based diet, not processed diet, and exercise and sleep and things like that, so it works for all the problems and chronic illnesses, for example, diabetes, high blood pressure, heart diseases, and it's true for the thyroid issues too, because everything starts from your gut. So basically, you're right that what happens that if you are taking Synthroid, or the outside, it's a synthetic thyroid, right? So if you have some work left on your thyroid, it basically suppresses your own thyroid function. So basically you just have to rely on your on the outside synthroid or synthetic medicine. So usually they have to check, and depends on how your lifestyle is, meaning what the food you are eating, your gut health and things like that. The thyroid can have issues, and then you have to adjust your medications, because the basic thing is to keep your TSH in the normal range. So that way the doctors usually check the thyroid function every 6 to 8 weeks. So if your TSH is high or low, depending on that, your synthroid dosing can be higher or lower. But of course, this is a synthetic thyroid which you are taking. So it basically suppresses your own thyroid function. So your own thyroid doesn't work as much if you're taking the outside.
The Ashaji's written down over here that she says the symptoms are fatigue, swelling, and inflammation. And then she's saying milk and wheat, they affect more.
Yeah, dairy and things like that. Yes. So basically, I mean, there are few things which, of course, we usually hear about a lot about iodine, which is a basic thing which is needed to make your internal thyroid hormones. Iodine is something that you cannot make it in your own body. You need to have it from outside in food and things like that. So you need to have iodine, which your thyroid gland, it makes the thyroid hormone from inactive to active form. So you need the iodine, it's a must. So we can talk about it, that where you can find these iodine in your food. So you know that iodine, we see so many salt, which is, you know, like added iodine and things like that. But sometimes you do not need it if you have a healthy, balanced diet, because iodine, you can find it, you know, in seafood, basically salmon, shrimps, and sometimes the seaweed and things like that. So it's very common in it's found usually in the seafood. So those are the things which you can, and there are, you know, sometimes fortified things with the iodine. So sometimes overdoing with iodine can cause problem too. So if you have a balanced diet, and if you are just having all these greens and you know, seafood or the fish and things like that, so you won't need extra iodine or added extra fun.
Somebody's asking actually Shaliji is asking a question. Can taking higher dose for hypo can lead to hyper? I mean, she means probably the higher dose of the thyroid medication.
Yes, it can. Yes, that's true. Meaning that, yes, yeah. So that's what happens, right? That's why the doctor checks your thyroid, which is the TSH level, every few weeks. Sometimes months, if it's been stable, you don't have to check it every few weeks. If it's been stable for months, then that is fine. But that's right. If you're taking synthroid, this is the, of course, synthetic thyroid hormone. So if you're taking more, you can be hyper. So that's why you need to have regular checkups. Basically, the idea is to keep your TSH level in the range.
So is that I mean, if you take, is that a good thing to do, to take a little higher than what you have, or should be?
Yeah, it's not good. I mean, of course, it's not good, because if low is bad, high is of course worse too. Yes, because higher means that your whole metabolism is so high, and the heart has to work, you know, like more, and there are other issues and problems with the hyper, which of course that's a totally different topic. But yes, it can be increased and can cause hyper if you're taking more synthroid or not the dose which you're supposed to. Yes.
Asha is writing that that she gargles with salt. Does that help? And then she says she's a vegetarian. So if you take salmon and seafood like shrimps and all, for that, is there any substitute that in vegetarians? For vegetarians, what can they do?
Yeah, so for vegetarians, there are the green leafy vegetables like spinach. So they have that. I don't know if she can have nuts or not,
Nuts,
because, huh?
nuts, nuts are good.
No, yeah, but I mean, I'm just asking like if you are vegan or vegetarian, I don't know if she can have nuts or not, but yes, like vegetables, like green leafy vegetables, they have all these things which is good for the thyroid, because as we will go further, there is not only iodine, there are different minerals, and because the thyroid, as I said, that there are 3-4 levels of thyroid function in different steps, where finally you get the active form of thyroid. And in different steps, you need different kind of minerals and things to make the active form of the thyroid. So it's not only iodine, there are different, other minerals which helps to make thyroid hormone, active form of thyroid hormone. So iodine, of course, is one of them. I mean, of course, you can have it in vegetarian diet too. And there is another thing is selenium, which is a mineral which converts the inactive form of thyroid to active form, where again, you can find it in shrimps or seafood, but vegetables like, of course, green leafy vegetables, spinach is it has selenium. Garlic has selenium. Spinach, again, it has more zinc and iron also, and vitamin A, which is very helpful in the thyroid function. So those are the things. And selenium is a mineral which you need. It's a very important part of, as I said, like at the thyroid functioning. Brazil nuts, it is very popular because it has a very high amount of selenium, just like a 1 nut a day. It is very helpful in the thyroid function. So those are the things basically you can have for the thyroid
So that
function.
means, like, well, what I heard was that cauliflower and cabbage and kale, spinach. I'm not. So these things are, are they harmful? I mean, it's not good for the.
Cruciferous, yes, sometimes they say that the cruciferous probably needs to be avoided, but probably that's what you have read. But these are like spinach, like a green leafy
Right.
vegetable, so that has more basically selenium, which works for the thyroid function.
I see. Well, that's
Yeah.
why I stopped eating kale, because I used to have kale salad and
And again, I mean, of course, when you eat something, it's not that you are eating kale like 3 times a day or like snacks and
once in a while.
fruit.
Yeah.
And I mean, of course, once in a while, I mean, I don't think it's a problem if you're eating once or twice a week or something. But uh, of course, I mean, that's why they say that, like it's a mix of everything that it needs to have green, some red, some oranges, because you can have something from one, like a green leafy vegetable. There is another thing which you can find in the orange colored vegetables. So that's why it's a mixed and of everything, because when we are talking about thyroid, you just have to choose that what you have other issues or problems in terms of like diabetes or heart diseases, where you can do all these things in one kind or 2-3 kinds of food, where it helps for rest of the things too, because some of the things you cannot do too much for heart diseases, not too much of the diabetes, but at the same time it's good for thyroid. But if you are doing like a balance of everything, then I don't think that would be a problem. And everything that we know that if you have plant-based diet, it can work for all the problems and diseases. So it's not like a conventional medicine where you have to take one medicine for one problem. You know, one medicine doesn't take care of everything.
Yeah,
But if you change,
a couple of questions here.
Mhm.
Kamlesh ji is asking, what is the reason that T4 is normal, but TSH is not?
So what happens is, because when you see the endocrine system, which is the system in our body, usually it produces hormones, and there are different glands which produces hormones. So body, I mean, of course, it is sometimes, it's a very complicated system. And sometimes it's very hard to understand, but in just like a simple terms, that there are different levels of the body where these hormones work. It starts in the brain, meaning there is one kind just for one hormone, like just like a thyroid hormone, which is produced in your thyroid gland, which is in your neck. It has to go through different stages, which starts in the brain. So there is a hypothalamus in the brain where it starts, meaning it produces a hormone, which in turn produces another hormone in different part of the brain, which is the pituitary gland, which again affects the thyroid production in the thyroid gland. This goes into your different parts of the body where the inactive form converts to the active form. So there are like 4 stages after it goes through where you see the final results or final product of the thyroid. So what happens is, because it's so much complex system, when your thyroid levels like T4 or T3, for example, your T3, which is the active form, is high, there is a negative feedback to your brain to produce less TSH in the brain. So it should not, it gives the signal not to make more thyroid in your body. So that's why if your T3 level is high, meaning if you have a high thyroid levels, it gives a signal to your brain not to produce more thyroid. So your TSH level goes down. So T3 and T4, which are the forms of thyroid, which is in your, because what happens is when you have a inactive form, or like for example, it's like a raw form, it is combined with all the proteins and all, so it doesn't work the way, or it cannot go into different cells of your body. It has to be in active form to go inside the cell and work what the functions of the thyroid hormone is. So it goes into a different level. So that's why I'm in the active form, which is the T3 level. If it is high, it just gives the signal to the brain not to produce more thyroid. So the TSH level goes down. So sometimes it's very confusing to the patients also when we say that you have low thyroid, which means that your TSH level is high, but your T3, T4 level is low. So T3, which is the active form, if it is low, meaning low thyroid level, your TSH is high.
Mm.
If you have a high or hyperthyroid, your T3, T4 level can be high and your TSH level is low. So, I mean, of course, it is sometimes very confusing, but for of course the providers or practitioners also, because of course you need to learn the whole system, how does that affect. But if we are talking about hypothyroidism, meaning that your T4 or T3 levels would be low and your TSH levels would be high. And basically you have to maintain a TSH level to adjust your Synthroid and the other medicines.
I see, that's how they do
So
it.
when you go see, yes, so it is of course complicated, because your whole hormonal system, it works in so many different ways, and it requires so many things and proteins and minerals, and as I said, iodine and all these things in different steps. And it's making that if you are deficient in one thing, then your thyroid function won't be that low. So that's why it's important to have all the balanced diet, that because sometimes we do not know that what exactly is the problem, when of course the doctors that just give you the synthroid, what is the reason your thyroid is low, you don't know. So it may be a possibility that your gut function is not good, meaning that what happens is the gut health is so important. And of course, it happens what you eat. If there is inflammation in your gut or your colon or your stomach, when it's inflamed, it's swollen, meaning the cells which are all connected in your lining, it doesn't work as it should. It's not tight, it's loose. So whatever the proteins or sometimes gluten and things like that, which is like causes inflammation in the body, it goes from your colon into your bloodstream. And the thyroid or your antibodies, just take it as a foreign body and it works against it, meaning that it just fights against it. It produces autoantibodies. That's why we call it like autoimmune problems. And thyroid, the most common cause of low thyroid is Hashimoto's thyroiditis, which is like an autoimmune problem, meaning your own body is working against your thyroid cells. So that's why it basically starts with your gut.
Gut. Can we take a that yogurt with prebiotics?
So probiotic, yes. So anything
that should be good. And also
yes.
What do you call it? They also have some
probiotics, yes.
Probiotics medication, like a pill or something.
Yes, they are. Again, these are, of course, you can see like when you go to store, there is one probably aisle for probiotics. So then again, of course, if you want to take supplements, that's fine, but you can have all these things in your food too. Like, we said that you have to have some antioxidants. So there are many food which has antioxidants. Anything which decreases the inflammation, like turmeric. So that is something that decreases the inflammation. So you have to add all these things to decrease the inflammation. So that's why it's so important to start with your gut. So basically, I think every disease process starts with the gut. And that's why the food we eat is so important. So what we eat and what is deficient, they both, just play a part on all the problems. So that's why, we were talking about the gut permeability or the inflammation.
Does eggs have any selenium or something? Does egg have?
I don't know. I have not read about it. Maybe I know that egg, of course, it's a complete, we call it like, like it's a complete health thing. Of course, the white and yellow both, because it has a lot of healthy nutrients. So I'm pretty sure that it has, but I'm not sure that it per se selenium is there. But of course, selenium, we see it a lot, in the seafood, then garlic, spinach, as I said, the nuts.
Right. So that means we have to basically, like you said, the gut is very important to take care of. It has a
exactly, yes, yeah.
Not only thyroid, other things can also come up with.
Yeah, exactly. So everything, it starts because when the gut is inflamed, so as I said, it's a very, the lining of the gut is tight. Yeah, like every cells are connected tightly. When there is a space between those cells, there is whatever you are eating, which can be, which should not be absorbed, that would be absorbed, and it works as a foreign body, and your body just fights against it. When it fights against it, sometimes body cannot recognize that it is from outside or if it is your own tissue. That's what happens. That's why it's called autoimmune problems. And one of the main reason of the hypothyroid is autoimmune. So the body starts working against it and it gets low. So people who have other autoimmune problems like lupus, celiac disease, and diabetes type 1, they should be checking on their thyroid because they can have that thyroid issues too.
Somebody's asking, I mean, there are two people, there are two different type of questions. Shali is asking, can the doctor set the dose without blood test? No, you have to do the blood test too.
So you start with the, I mean, of course, the general rule is when that, and again, every patient is different because they may have other issues, they may have other problems. So starting synthroid or medicine, it just depends on overall health, other heart diseases and all, because synthroid, again, it can start your metabolism, because if you're deficient, then it start. If you have some heart issues and problems, sometimes you have to start with a lower dose because the heart starts to work fast and then it can cause issues and problems. So basically the rule of thumb, I mean, of course, general is when your TSH is more than or greater than 10, then they usually start with the synthroid, and we start is 1.67 micrograms per kg per day. But again, we start with a lower dose if there is some heart issues and problems.
And also, Asha ji is asking, turmeric and all berries help? Turmeric you just mentioned. And what about berries?
What, I'm sorry, what is that again?
She said, she's asking, is turmeric, I mean, we just discussed that it's good to have in all of, like
berries?
Berries, how about?
Yes, yeah. So yes, because it's an antioxidants, right? So antioxidants meaning whatever the inflammatory things and oxidants and free radicals, whatever the things which causes problems in your body, the antioxidants like blueberries and berries, they work on it. So it improves your immune system. So anything which improves your immune system, it's good. So you can just see that whatever the things which can.
It's just a general, I mean, for me, general thing. When I go to my doctor, okay, she prescribes, she does the blood test and everything, but like the way you're explaining to me, don't you think she's also explained that about the gut, about putting turmeric in your diet,
yes, yeah.
They don't tell you anything, just give the prescription.
Exactly. Yeah, so that's the thing. I know, because
they don't tell you all
that's
this.
What exactly. So that is called like conventional medicine, which all the doctors we are doing. So meaning that you cure the disease or manage the disease.
Yeah, they should teach us a little bit how to manage instead of going up.
Exactly. So yes, so that's why that's what happens.
She should check this, do this, eat this, do this. That would be that would really help everybody,
Correct. Yes. Yeah. So the conventional medicine, I mean, it's not that only one that's what the conventional medicine is, that and that's what we are taught to do it. That's what our training is, meaning to find, I mean, of course, just whenever there's disease, you take care of the disease, like try to cure it, or acutely, if there is some acute problems going on, then fix it. Sometimes, you do not see the real causes of it and how to prevent those, that from the start. So that's how, I mean, of course, the lifestyle medicine and sometimes preventive medicine and things like that, it comes into play, which of course, then you have to just give a little bit more time on these things. So again, when you read it, I mean, of course, it has to be incorporated, but of course, it's a totally different kind of things where you have to read and work a little bit more. But the preventive medicine, of course, when you go see a doctor, basically those doctors, the internal medicine doctor, your general practitioners, they are the ones where we have to start incorporating this a little bit more. I mean, of course, the medicine is there, but sometimes these kind of education for basically both of us, the patients and the doctors.
Yeah,
But
that's something. I mean, listening I'm taking for the last, like I said, 15 years, and it went up a little bit. That time she should have told me, she should have given me a pep talk. Listen, it's going up. You better check this thing, take the prebiotic, do this, then it'll go back. It might reverse, you know.
mm,
Now, another
mm,
question I have is maybe a silly question because my daughter, she also has thyroid.
hypo.
And yeah, she has the same thing like me. We take the same. Sometimes she forgets the
Mm.
medication. She takes mine because it's the same, 75. But on the whole, she only believes in taking the original one, like Synthroid. I take the generic. Is there any difference?
No, I don't think so.
Difference in
I mean,
allopathy?
it's just some people just were. I mean, I don't think it will make or cause any difference. Sometimes, um, we have seen, for example, just one medicine, for example, seizure medicine. Some people just may not absorb the kind you're taking, and they just have to have a different brand. Because of course the generic, the medicine, the active part of the medicine is the same, but in different brands, whatever the inactive form, they can be different. And sometimes you can be just not absorbing that form or things like that. But basically the active form is the same. I don't think it has any, it makes any difference, brand or generic.
So it doesn't make. So she says she likes to take the original one, Synthroid. She doesn't like to take the generic. I said, but I'm taking that. But she said, no, I like to take that one. So we have that discussion sometimes.
Mhm.
Asha ji is also asking that she takes extra virgin oil with lemon and black pepper also helps. Does that help?
Olive oil.
Extra virgin olive oil with lemon and black pepper. Maybe
That can, and again, I mean, of course,
that's good
that's
for salad, right? That's good for
huh?
salad. Usually this thing you put in the salad, like a green salad, you can
Correct.
put
Mm-hmm.
extra virgin oil, you can put lemon and black pepper and make a nice dressing. But
Mm-hmm. Yeah, because actually I was reading, as we said, I mean, of course, there are different minerals and then that iodine and things like that. But again, as I was explaining, of course, that's a little bit complicated, but different stages of thyroid function, you need different kind of, like a maybe amino acid or, as I said, um, this mineral and things like that. So we know that mainly the iodine is the most common thing which when we connect it to the thyroid, because of course it's I believe is the most important thing, because otherwise if you do not have iodine, you cannot make thyroid hormone, so the active form. But other things which we were discussing, because it starts with your gut, so anything which can improve the inflammation of the gut, it can cause improvement, and in turn it just helps with the thyroid function. Because now today we are talking about thyroid. Of course it probably work for other problems too, like diabetes and heart diseases or any kind of problems, but because we are talking about thyroid today, so of course decrease inflammation in the gut improves it. As I was basically reading for coconut oil, so it has lauric acid, which is medium chain triglycerides. So this coconut oil, it prevents the growth of viruses, bacteria, and any kind of fungus in your gut, and then it can decrease the inflammation and it improves the gut health. So that is one of the things which improves the inflammation too. So I think some people, they just have, just sometimes they cook in coconut oil, sometimes they just add a teaspoon or something in their coffee, or just use it however you want to use it. But it has this triglyceride which is helpful in these kind of bacteria and all, because you have like millions of bacteria in the gut, and there are good bacteria and there are bad bacteria, so they are in a balance, which helps in your weight management, it helps in your inflammation and things like that. So if there is an imbalance of it, it can cause many problems. So when we just take any kind of antibiotic, just even for viral problems and all, it basically causes a lot of issues in the gut because it just takes a while to have your gut bacteria, the healthy bacteria, back to their normal, to their original level. So
Coconut
that's
is
why it's so
coconut
important.
oil. That means we should
Yeah.
start using that in some form. Coconut oil
Yes. Yeah.
help with the gut. Asha ji is also making this. She said that she takes, like I said, she takes extra virgin oil with lemon and black pepper.
And we know, of course, olive oil, we know that it has a lot of benefits. There may be something with the inflammation and all. So anything which decreases the inflammation, anything which has antioxidants, of course, is basically good for gut.
Also, she's saying that ghee and turmeric with black pepper is also good. I think ghee
Maybe,
is also
yes, yeah. Right, right.
good for the gut. The ghee, will that is good for the gut? I mean, this kind of.
I mean, of course, I don't know that, but I'm just hearing a lot about the original or desi ghee and things
Yeah.
like that, and they have some benefits. It just depends that what kind of the triglycerides or fat it has, because all fat is not bad, right? So there are good fat and bad. So whatever good it is, then it can. That's why we know that olive oil has good triglycerides and things. That's why it's good. But know that it is something that is it has some benefits too. But turmeric, of course, we know it's anti-inflammatory. It's a very good anti-inflammatory things, and we usually, and I think in our food we basically I think add in our curry and things like that. So we cannot avoid turmeric from our from our diet because it's so common in our food.
Yeah, that's true. That is true. Coconut for cooking.
Yeah, so that is the thing.
Eat the thing. Eat coconut.
Also I was
Only the oil, or is it can we eat coconut? Is it just like I love coconut.
coconut is
Same
good
thing,
too.
same
But
benefit,
again,
same thing.
and again, I mean, of course, it can be just in the balance because like a lot of coconut is not too good either for the other things too. So I think again, if we are eating coconut, we won't be eating it like every day, like 3 times a day, or like. So it's something, whatever the balance you can do. I mean, I don't think that if I eat coconut today, I'll be eating like for whole week of the coconut. So it's something that you just can add, in your daily or routine, a little bit of it. But too much of coconut, I think it's not good maybe for other things because of the type of fat or triglycerides and things like that.
It's true. Like some people I know, like in India, my cousin was telling me that every morning she takes 1 spoon of ghee.
Coconut oil?
No, no,
Ghee,
no.
yes, yeah. The ghee,
Ghee,
okay.
and then she takes a tea, whatever it is. First thing in the
Mm-hmm.
morning she does that.
Maybe. Yes, I have to read more on this Desi Ghee kind of thing, but I know that maybe they are doing more research on that or things, but um, it I have heard about some benefits about the ghee, and I think they do it first thing in the morning for of course maybe for your gut also,
Yeah.
like maybe just a protective lining kind of thing. But I was reading that bone broth, it is good for the leaky gut also, because it also helps decreasing the inflammation and uh, which can help with
I've
the
been
thyroid function.
I've been taking that, like I got this this company, I read about it, and then they have it like in a powder form. 1 packet, you can get packets, and all you got to do is add that in a nice hot cup or something, and just drink it. So
Mm,
I think that one every day is supposed to be really good for a lot of things, skin and
mm.
other things. Even the
Yeah,
gut.
and again, because of course, if you're taking it like in a packet form, there may be different kinds and types, because bone broth, meaning that you have to keep that bone to a certain
She,
degree and the times to, remove everything from that bone.
she was showing that she cooks. I mean, they make it in all kind of
Big,
stuff. It takes a long time.
mm,
So she's made it into like, dehydrate it and make it into packets. Explained the whole thing's very natural, and I read the whole thing. So I said, instead of making it, it's going to take a long time.
Long time, yes. And plus, I mean, of course, you know that, because it's an anti-inflammatory when you have flu or something. So it is a very old kind of,
Yes.
totka kind of thing to have a bone broth, just yakhni. When you do
Yes,
yakhni,
yes.
I don't know if you know, yes. So this is a very old, it's,
Oh yeah, anybody having a
I mean, of
baby,
course, yeah.
having a baby, that they usually give that.
Because it's a bone broth, yes. So it is a very old kind of todka where, of course, these the Western world and things like that, they are getting all these research and making it a more, more user-friendly kind of packaging and things like that. But of course, it's a very old thing to have yakhni for any kind of problems, especially flu and things where it is number one thing. They say that, when you are drinking bone broth, it just works too good for the flu and any kind of common cold and things like that.
Yeah, so this is a beneficial.
Because it decreases inflammation.
Yeah, I gave it to my daughter. She had a baby, but they don't listen to you. The packet is still there. I said, give it back
Yeah,
to me.
yes.
Expensive.
Yeah, right.
If you don't want to use it, give it back. So I'm using it
Yeah, because,
mostly once a day. So I think it's
good, huh?
good. So it does help.
Yeah.
She's written down there's a whole article and everything. She researched it, everything. So she did that. So I said she made it life easier than to do the whole thing yourself. It takes hours and hours to
Yeah,
make.
I mean, yes, if you have any preferred, just brand, you can just text me too and that so we can see. But of course, because whenever a thing comes, then everyone just makes it, and sometimes it can be not too good, and just you don't know what is in the packet.
I did research it because I just happened to find out, and then I read about it. So she also she has different things that are all naturally made, but this is the number one thing, the bone broth.
Yeah, and again, there is one that, like walnuts. It has omega-3 fatty acids. It's very good for the gut health. But I was reading that if you are taking Synthroid, you cannot take walnuts at the same time because it decreases the absorption of Synthroid. So, meaning, of course, you can take it later or something, but not, like at the same time when you're taking Synthroid.
You can take the walnuts later on during the day.
Yeah, yes.
In case you take it in the morning, but you can during the middle of the day or in the evening or something, you can take a little.
Because it can decrease the absorption. Yeah.
So that was it. Anybody has any other questions? We can, very great. Asha just saying she uses coconut for cooking, coconut oil for cooking. That's good to know. So anybody.
And then there is pumpkin seeds. Pumpkin seeds.
Oh yeah.
It's very good in terms of making the thyroid hormone because it has an amino acid which is called tyrosine, which links with the iodine to make hormone, meaning the inactive to active form. So pumpkin seeds, they are good too.
Good, that's good to know. The pumpkin seeds are very easily available in the market. Those, I also think I also of them. I don't take it all the time, but I have. So it's good to have these things are easily available. One should take advantage of that. Share that Dr. Kellyanne, she's the one who has that bone broth. Her name is Dr. Kellyanne. She's a doctor as well, and she's come to all these different Channel 4 and all that stuff. So anyway.
So how do you find it? Like it's like somewhere you have to order?
Yeah, I have to order it from her company, and they send it to me like every. It depends on how much you want, about 6 weeks or whatever. Depends how you want to have it. So I did auto shipment, so she's sending me every 6 weeks.
Weeks or so. Okay.
Finish that I can, I don't have to wait for it. So I'll send you the name, and if anybody's interested, I can put it in this group as well. You can take a picture and send it there. And I like it because, like I said, it's so many hours of doing it yourself. Nobody has a time, and then
maybe there must be something like you just do it one time for a week or so, and then maybe store it.
Fine. That's good. That's a good thing to do. but I find this easier for me just to put it in the, you know,
Oh, of course. I mean, of course, anything in the
I read
packet is
read what
that's
she
fine.
said, and then I think it makes sense. So anyway, that's thank you so much, discussion. Thank you so much, Neelam ji, for joining. Kamlesh ji, Asha ji, Shali ji, and Dolly also, and Rama ji, and Shashi Dhanda ji, and also I have I think Kiran Chibad was here, and then there was somebody else, a couple other people. Yep, a lot of other people. Kiran Gad was here, I think. Yeah. So thanks a lot for coming, and all the questions were very good. I like to have it. Okay, sure, sure, Kamlesh, I will share it. It's good for your health. I mean, anything, it's good to give it a try, Kamlesh ji. And anybody else wants to do that, they should. I'll share the name of the company, the package that I have. Send a picture in here, and then you can order it from them. So, I mean, any suggestions for next time discussion for the next topic? So let me know, and we can request. I think this topic was, I think, requested last time when we were here about thyroid, and that's why we had this discussion today. So anything,
Correct. Yeah.
then you let me know, and otherwise we'll thank Dr. Erum for coming. Thank you so much for all the knowledge, and everybody saying. She said that thanks for covering the details in most easy way. Very knowledgeable. Ms. Kamlesh ji is asking, and
Thank
that
you.
discussion was very knowledgeable. Auto body infection and auto body infection, low blood pressure treatment. We can talk about one of those topics. What do you think? Low blood pressure or auto body infection and infection? I like the low blood pressure, or one of those topics we'll discuss. Low blood pressure. Why do we have that, or what can be done to prevent it? Low BP.
Low blood pressure is again, it's something that some people just have, low blood pressure. If you're not having any issues with that, so it's not a problem, unless that if we call it like orthostatic hypotension, where when you suddenly sit, when you just stand up from sitting position and it drops, then that's a problem. So, but otherwise, if your blood pressure runs low and you are functioning fine, it's not like a problem. Some people, they have just, like a low normal blood pressure, unless it's causing any kind of problems. I don't think there is anything you can do. I mean, you just have to keep yourself hydrated and things like that. Sometimes when you go for a blood draw, they cannot find your veins, and there may be sometimes you're dehydrated, your blood pressure can be low.
That's true. That
But otherwise, or if you are on some blood pressure medicines and it's just so high doses that your blood pressure is lower than normal, it should, because it should not be too low in terms of if you are on any kind of blood pressure medicine, meaning you need all the blood flow to different parts of the body. But if you're not on any medicines, you're functioning fine, you are well hydrated, your blood pressure runs low normal range, that's your normal then.
Yeah, that's true. So medication, I mean, you also have the medication for low blood, but if you are functioning all right, then it's okay. Low is not that bad. It's good. A lot of time when I go to the doctor's office or something, it's a little bit high.
Correct. Yeah, because you just because just taking the blood pressure is a different, it's itself, it's a skill to take blood pressure, meaning that you have to just be there for a few minutes, relaxed. You cannot take blood pressure before or after you are eating, things like that your heart rate, blood pressure, everything, you just relax before taking, because as when we go there, we are already a little bit stressed and anxious about the doctor things. You just go there, the nurse just comes and quickly takes your. So last couple of times I went to the doctor, my blood pressure was so high, and I was like, I mean, as soon as just I sit there, I mean, of course they are in so much hurry and things, that you just sit there, then you are still catching your breath and they are taking your blood pressure. So of course I know that it would be high.
That's what happens to me when I go and wait over there, because I don't like to wait. But when I go in there and wait, and the nurse comes and checks your weight, and are you sure that's the right machine? The machine is working properly? How
Yeah,
to some
weight, I mean, of course, the weight you cannot change, but the blood pressure, of course, you just
then
need
she
to
takes the blood
relax a
pressure.
little bit.
I said, how come I, then she does all this, the pressure and everything. Then I said, no, my weight is different at home anyway. Then she takes the blood pressure, then, and then when the doctor
Take it
comes,
whatever is
oh,
low. Huh?
the doctor comes in, then by that time I'm calmed down. Then she takes it again. She said, see, it's gone down. So that, I'm
So
just,
that's why even if your blood pressure is the one reading is high, you just do not start the medicine. It has to be 2 or 3 times. And as I said, that different, like at home or in the office and things like that, because there can be many other reasons for high blood pressure. One of them is just your anxiety.
exactly. So anyway,
Mm.
we'll end it here. We'll talk a little bit more maybe about this thing next time and a couple of other things like joint pain or like Asha ji saying, joint disease or infection, anything like that, but we'll talk more about that. So thanks so much for coming, everyone. It was a very great session. We learned a lot from Dr. Erum. She's wonderful. She teaches everybody in a very detailed manner, which we can all understand. So that's why it's good that you ask questions as well, all of you, including me. I asked a lot of questions. So thanks so much, Dr. Erum, for coming and
Yeah, sure, of course.
I thought about this. It's a very important topic. A lot of people have it. Sometimes
It's very common. Yeah.
goes undetected for a while until
Mm.
find out in some way, blood test or something like that. So thanks so much, and we'll see you soon, and we'll come back, and then we'll discuss some other topic. So I want to say,
Yes. Yeah.
I'm just going to get off. Okay, let's see. Okay, okay. So when is the next? When is good for you?